School is starting across the state. COVID-19 poses a threat to our kids, and our kids need to be protected, and they need to be in school.
Hello and welcome to KGW News at 5 o'clock. Our top story, a major announcement from Oregon Governor Kate Brown. The state's teachers and healthcare workers will now be required to get the COVID vaccine. Thank you for joining us. I'm Laurel Porter. The decision comes as kids get ready to go back to school and unvaccinated COVID patients fill hospitals. Tim Gordon has the details and reaction.
There is no getting around the damage being done by COVID-19 in Oregon. Governor Brown described the situation with 93% of hospital and ICU beds full.
When ambulances have nowhere to go, people die preventable deaths. I am devoting all available resources to help.
The governor is also now requiring all working in K-12 education to get vaccinated and ending a vaccine exemption for people working in healthcare that allowed them to get weekly testing instead. All will need to be fully vaccinated by October 18th or 6 weeks after full FDA approval, whichever is later. Part of the reasoning.
The Delta variant has put enormous pressure on our health systems. There are simply not enough resources to stand up weekly testing systems while also responding to the current crisis.
As of Thursday morning, 845 Oregonians with COVID are hospitalized, 226 in ICUs. It's a 42% increase from last week, a 500% increase in the past month.
Patients are parked in hallways. Staffing is critically short. I need to be direct about what's causing this crisis. A growing wave of unvaccinated patients who have become so seriously sick with the Delta variant they need to be hospitalized.
Given the severity, I asked the governor why not impose the same vaccine mandate on staff at Oregon's colleges.
As I said earlier, all of the options are on the table, and we will be having those conversations.
Why not yet, though, Governor, for them?
As I said, I certainly took the time to have conversations with the educator workforce, including our superintendents and school boards. We'd like to do the same thing with our higher education and childcare partners.
As for the vaccine requirements, the governor did just order.
There are those who will disagree with the actions I'm taking today, but school is starting across the state. COVID-19 poses a threat to our kids, and our kids need to be protected, and they need to be in school. And that's why I'm willing to take the heat for this decision.
We did hear some good news today about reinforcements coming in. FEMA is sending 24 EMT paramedics to help mostly rural hospitals. And as many as 1,500 Oregon National Guard members are being deployed, the first 500 starting on Friday. Tim Gordon, KGW News.
The Oregon Nurses Association put out a statement responding to the governor's announcement. It said while they understand how important vaccines are, they're worried about the effect this will have on nurse staffing levels. They're urging hospitals and healthcare systems to focus on nurse retention and recruitment. Washington also has new coronavirus restrictions coming. Governor Inslee announced yesterday most education workers in K-12, early learning, and child care and higher education must get vaccinated. They have until October 18th to do so or risk losing their jobs. The statewide mask mandate is also expanding beginning Monday, August 23rd. All people, regardless of vaccination status, must wear masks inside public places. This morning, state health authorities said there are more COVID patients in Washington hospitals right now than at any other point in the pandemic. There's concern the new vaccine mandate may drive school bus drivers away. There's already a nationwide shortage, and it's hitting Washington, too. About 40,000 to 50,000 school workers in the state have yet to be vaccinated. The problem is bus driver positions can be difficult to fill, even outside of a pandemic. And if districts can't get fully staffed, they'll have to cut down on routes or find substitute drivers.
It is a challenge to keep a full gamut of bus drivers on course and ready to go. Our hope is that those that aren't vaccinated talk with their doctors, get all the information they need to make an informed decision.
In his announcement yesterday, Governor Inslee urged people not to leave their careers over refusing to get vaccinated. He says that's partly because most people who do so won't be able to get unemployment compensation. The struggles inside hospitals are the focus of the first of our special reports on the COVID crisis here in Oregon. These stories aren't about wearing masks, state policy, or getting vaccinated, although those are important parts of any story about COVID. This time, we are in the ICU of area hospitals where people are fighting for their lives. Pat Doris starts our reporting from Bend.
St. Charles here in Bend is a hospital in crisis. It has a staffing shortage and it has a big number of COVID patients that have come from all over the area, a total of 61 on Tuesday. I was able to spend a lot of Tuesday in the ICU where there were 9 COVID patients, 3 fighting for their lives, and watch doctors and nurses do everything they could to try to save the patients. At one point, they called a patient's husband to ask him if he wanted to come onto the ward because they thought his wife would likely die. He was not able to because he is also COVID positive. I also was able to spend some time in the ER and talk to doctors and nurses there, many of whom have been fighting for 18 months to save people's lives and to keep them healthy, and they are very burned out. Here's what one had to say.
I'm angry at everything. I'm angry at patients who chose not to get vaccinated. I'm angry at the health system for not being able to handle it, even if it's not their fault. I'm angry at myself for not having done more early in the pandemic. Yeah.
And maybe angry at yourself for being angry?
Yes, very much so. Yeah, it's hard.
And as bad as things are here now, they worry it's just going to get worse. Over the next 2 or 3 weeks, they expect a surge of even more COVID patients because in the surrounding areas, the vaccination levels are not that high, and they worry about where they will put all the patients. I'm Pat Doris, reporting from Bend.
Our series is called Overwhelmed, Inside Oregon's ICUs. You can watch Pat's full report tonight at 6 o'clock on The Story, and we'll continue this series this week and next week. In tonight's Verify, it's a false claim surrounding mask safety when it comes to kids. Some parents claiming they're dangerous for kids, but that's simply not true. Ariane Daytil with our Verify team has our fast facts.
As kids head back to school, parents are heated over whether masks should be required in class. Some are citing a study that claims masks aren't safe for kids. So let's verify. Do face masks really increase carbon dioxide levels for children? Our sources, the JAMA Network and the American Academy of Pediatrics. In June, JAMA Pediatrics published a study from German researchers, claiming children's masks trap concentrations of carbon dioxide that are dangerous for kids. But in July, JAMA retracted that study, citing issues with its methodology and conclusions, saying the authors didn't provide convincing evidence. The American Academy of Pediatrics insists masks will not block the oxygen a child needs, and that carbon dioxide molecules are too small to get trapped by the material.
There is no increase in carbon dioxide. There's no detrimental effect of the mask in any way, shape, or form.
So we can verify this claim is false. Masks do not increase carbon dioxide levels for children. With your Verify, I'm Ariane Daytil.
Multnomah County is now investigating a third death related to this month's heat. The victim died in Portland on August 18th. The other 2 deaths happened on the 15th and 16th. All 3 cases are still being investigated. This comes after 62 Multnomah County residents died in June's historic heat wave. Before this summer, there had only been 2 heat-related deaths in the county since 2010. Developing tonight, police are investigating a shooting in downtown Portland. It happened by Southwest Broadway and Pine Streets at about 8:40 this morning. One person was shot and has serious injuries, but is expected to survive. No arrests so far. Police haven't said what led up to the shooting. They're asking any witnesses to contact them. A group in Hillsborough is looking for answers after a community fridge meant to help neighbors in need is vandalized. Here's Christelle Kumwe.
Thank you. Appreciate it. I'm grateful and thankful because there's times when I'm hungry and stuff like that, I'm not on my feet yet, but they're here.
The community fridge on East Main Street in Hillsborough has served neighbors in need since December.
It's just a fridge for anybody to use, kind of take what you need, leave what you can. And there's food, there's drinks and stuff like that.
It's a project by organization Love Your Black Community. Dwindell Feely is part of that group, who even brought in a local artist for the artwork.
For me, it was not only just having thought-provoking black art, but also to create paid opportunities for black artists in Portland.
But on Tuesday afternoon, they discovered the artwork had been tagged with spray paint all over the words, "Justice for George Floyd."
Honestly, I'm very disappointed. I'm very kind of angry, honestly.
Angry because it's not the first time one of their community fridges was vandalized. This time around, they emptied the fridge in fear of contamination.
It's happening like too much now, and it's just it's a hate crime to me. It impacts a lot of the community, so it's not something where it's like, okay, we're going to get rid of it.
They now hope to raise funds to help clean up and fix the damage, but they have no plans to stop running this community fridge and help their neighbors in need. I'm Christelle Kumwe for KGW News.